Hey y'all. I don't usually come to you in this like super casual, dark, slanty-eyed kind of sleepy mode. Even though it's not late, the light in front of me is kind of bright, so I'm squinting. So sorry about the eye thing. I'll try to, no, oh wait, maybe that's better. Now you can see me. So I haven't gone public with this announcement yet because why? Well, there's a couple of reasons. I'm eating dinner, but I felt inspired because I was talking to a friend who has more than maxed out her credit cards and similar due to insurance not covering women's health issues. And I'm so freaking sick of it. I just can't stand it. It's what I see every day in my practice as a pelvic and ortho PT. And this is not on the surgeon. This is not the surgeon's problem or fault. No, they're brilliant. They're brilliant and they're saving lives. The problem is that our research has not caught up to where these surgeons are. These surgeons are far beyond the power curve for saving women's lives, vast majority women's lives, in doing this surgery. Saving their fertility, saving their quality of life, saving, in some cases, their life because they can't function because they're in so much pain. That's me. That's me over a decade of infertility. Well over a decade. Being told I'd never have children. Well over, really the decades are just like, they blend into each other. My entire life after hitting puberty, being in pain. Unexplainable. Weird, unexplainable. Did it force me into healthcare? I don't know. Did it lead me into healthcare? I don't know. Did it lead me to, into integrative medicine, where I ended up writing 2 books, editing one, contributing some chapters, writing an entire other one, pursuing doctoral studies for the same reason? Like, did my pain and the medical gaslighting that resulted from my pain drive me into the career I'm in, drive me to talk to you while I am enjoying a little bit of what's left of a glass of wine, and say, for the love of all that is good, if you feel like you're being medically gaslit, you are. If you feel like your provider's not paying attention to you, they aren't. And yet, usually as women, not always women, this can happen to men too, and particularly transgendered folks, where you feel like because you suffer from these symptoms, particularly pelvic health, GI type symptoms, that, oh, it's just normal. It's just in your head. You just have a low pain tolerance, whatever. Bullshit. I know. A doctor can swear. We do swear. A lot of us swear. And you know what it's in relationship to? Medical gaslighting. We're in a profession where we see our patients being gaslit. I was gaslit, even by colleagues who are my friends, mind you, who have my best intentions at heart, totally. Accidentally. It's not on purpose, medically gaslight me. Oh, that doesn't sound like fill in the blank, whatever the diagnosis is. That doesn't sound like a particular diagnosis. So what's my point? It's a little bit of rant. It's a little bit of validation, because if you're listening to this for this long, for 5 minutes in, you're ranting too. And you feel my frustration, and I feel your frustration. This is not my story. This is your freaking story. This is your story. You weren't listened to, you weren't seen, you weren't heard, you were medically gaslit. You probably have at this point had multiple surgeries that you didn't need to have, and or you needed them, but they didn't do the right thing in relationship to pelvic health. I have heard of stories where urogynes are doing surgery for prolapse at grade 1 or 2. Hold the phone. That should not be happening. If a surgeon says, oh, you have a prolapse, we'll just wait and see. No. You go see a pelvic PT. They will help you. You find someone who fits pessaries and has advanced training in prolapse. They will help you. Do not listen to an OBGYN or urogyne who says, oh, well, you just have a prolapse. Let's wait and see. No. No. Or they say, oh, you have a prolapse. Well, prolapse, what grade? 1 or 2? Oh, we can do surgery for that. No. No. A grade 1 prolapse doesn't even actually by definition have to be a prolapse if you're reading the current literature. So no, do not listen to someone who tells you you have to have surgery if you have a mild prolapse. So I just want to say that you know your body better than anyone else. If you feel not heard, you're not being heard. If you feel not listened to, you're not being listened to. If you feel disrespected by your provider, you have been disrespected by your provider. Because these feelings don't come lightly. You don't get these feelings after 1 visit or 2 visits, right? You get this over decades of being ignored. And I am sick of it. So next week, I am going to endure an incredible financial burden. It is what it is. To hopefully vastly improve my quality of life. I have no idea what the outcome is. I have no idea what the prognosis is. I have no idea what the recovery time is. You want to talk about scared? That kind of stuff makes you scared. You're going under. You really don't know what's going to happen. And I'm self-employed. And I have lots of other swirling issues, not privy to the public ear, that are going on that make things exponentially more difficult in ways that, you know what? If I'm lucky, I'll be able to share it with you in a book one day. Because I think it would help many people. Just sharing your story helps other people. So my encouragement to you is, if you feel like you've been medically gaslit, please reach out for support. Keep searching for providers that will listen to you. If you don't think anyone's listening to you, I will listen to you and I will help point you in the right direction. This isn't about me taking your money for, paying me for services or something. No, this is about you as a human being deserving the support and healthcare that you need, period. So keep searching, fire your providers. If you can't find the right providers, reach out. I will do my best to help point you in the right direction. If not, I will help send you to someone who can. And the other part of that is, if you are having GI, pelvic pain symptoms, and even far-reaching symptoms, sorry, that's my dog. She's waiting on dinner. My dinner. She's already had hers. If you have these strange symptoms, they could be respiratory diaphragm symptoms. They could be vocal symptoms, what I call orofacial symptoms. Not just pelvic symptoms, not just tight pelvic floor, not just painful attempted intercourse, not just GI issues alone, but if you're having like a range of these symptoms and someone's saying, I had an OBGYN tell me this. Oh, your GI symptoms, they have nothing to do with pelvic pain. BS. Don't listen to that. Do not listen to that. Your GI symptoms, yes, absolutely can be related to your pelvic pain. Sorry, I'm getting worked up, so my hand is shaking too. GI, pelvic pain, they go together. Respiratory issues and pelvic pain, they go together. Vocal issues and pelvic issues, they go together. So I hope this video helps you. I hope it encourages you to keep searching for the help you need. I hope it validates that you are not crazy. The pain is not in your head. And if it hurts to breathe, it could be pelvic pain. If it hurts to speak, it could be pelvic issues, and vice versa. If you're leaking, it could be a vocal issue. Don't neglect that, and don't let anyone tell you it's not related. It is related. It is evidence-based, scientifically supported, scientifically grounded. All right, guys. I hope this hasn't been too intense. I did swear a few times. Sorry about that. Kind of sorry, not sorry, because the neglect of traditionally women's pelvic health issues is criminal in this country and beyond. That includes the lack of prenatal support, the lack of postpartum support, the lack of perimenopausal, menopausal, and postmenopausal support is absolutely criminal. And so with more videos like this, I hope to change that, raise awareness, and I hope this has been helpful. If you can't find the support you need, please reach out. GarnerPelvicHealth.com, IntegrativeLifestyleMed.com. If you like this video, please subscribe, share it with your friends, and I think that is it. If you want to give me, I think there's a thanks thing, like people are sometimes like giving me like tips or something for videos. I don't even fully understand it yet. But you can do that because it helps me do videos like this because I have to pay the bills too. So yeah, thank you guys so much for your support. And I support you wholeheartedly because you deserve integrative, thoughtful, comprehensive, compassionate voice to pelvic floor healthcare.